right, welcome back inside our proactive newsroom. And joining me now is Dennis Hancock, the CEO of Mountain Valley MD. And Dennis, good to have you back.
Thanks for having us. Great to see you.
And also joining us is Dr. Mike Farber, the Director of Life Sciences for Mountain Valley. And Mike, it's always great to see you as well.
Great to see you, Steve.
Mike, just before we talk to you a little bit, I want to talk to Dennis quickly, just to remind everyone a bit about Mountain Valley MD. And what I like about it is in all of your news releases, you always talk about the fact that you're here trying to solve problems. And that's a big part of what you do at Mountain Valley. Can you sort of elaborate a bit on that?
I mean, I could pick that up in the sense of, people do say, man, you guys are moving fast and you're working on these broad problems. And there's no doubt as we expand even that class of drugs, it was never just to start, in one little area. Our visions and ambitions have been working on the largest problems, the most difficult problems. And there's no doubt that, the pace that we're moving and the direction we're moving, we get more excited about the largest transformation of the technology versus a bunch of small trials.
Yeah, and that leads us into today's news. And Mike, maybe you can talk about that. Quicksol. Tell us what this is and what you've been able to accomplish, which has not been done before.
Okay, so this is the latest continuation of our Quicksol technology that we previously talked to you about with ivermectin. We've now applied it to Selamectin, which is another one of the macro-cyclic lactones. It has a proven effect on parasitic infestations in dogs and cats. It's even less soluble than ivermectin is. So solubilizing it to the extent that we have is really a breakthrough in allowing us now to look at the human applications and better husbandry animal applications for a drug that really has tremendous potential, not just in parasites, but also in certain types of bacterial infections, specifically mycobacterium like tuberculosis.
Yeah, let's talk about that because that's significant what you're talking about here with tuberculosis. Just sort of expand a bit on that and the treatment for tuberculosis.
So currently tuberculosis is the #1 infectious disease killer globally. It infects probably almost 2 billion people worldwide. It spreads to about 10 million people annually, kills probably 1.5 to 2 million people a year.
Wow.
It's a infestation or a disease that's very hard to treat because it's localized in the lung. So you have to get some type of medication that basically builds up in the lung tissue. The other problem is that mycobacterium has a tendency to mutate, and they're now becoming more and more resistant to most of the drugs being thrown at them. So using Selamectin as a novel drug mechanism to treat this, I think is a real breakthrough. And I'd like the people looking at us to understand that Mountain Valley focuses on taking drugs that already have proven safety and applicability and making them better drugs. We're not inventing new drugs. What we're doing is we're taking the path of least resistance to bringing novel therapeutics to the market by repositioning old, proven, safe drugs. So that's a much faster way to solve problems currently in the world than developing a new drug. New drugs take decades, and sometimes even new vaccines take decades, and their potential is maybe 1 in 100 to succeed. When you take an old drug that you already know has a proven safety profile and you now can reposition it, your chances of success are much higher. So I think Mountain Valley is very smart in what we're doing because we're taking a look at drugs that have real potential but have limitations based on solubility and bioavailability, and we're solving those problems to then solve really global problems that are confronting us today.
Dennis, I imagine when Mike opens the door and says, "Hey, guess what we've done?" You're probably thinking, "Okay, here we go again." You've obviously filed a patent on this already, I would imagine, or pretty close to it.
Yep, that was filed yesterday. It was kind of cool though, because I knew they've been working on this project for several months as we, across that broad category. And even that photo that's circulating around today, that was taken on my cell phone last night back in the lab. So it was kind of cool, just straight up on a classic iPhone And pretty cool to be that close to show, hey, here's what it is. And, you know, and if I were building on what Mike was saying about the population and the size, when you start to imagine a quarter of Earth's population, right? What does this mean? How do you do it? You know, the other piece of this also delivered through our technology is a candidate to be delivered, you know, at a fraction of the current prescription levels. So if we could be into a 1/10 of the API again and start to do really incredible things that could meet the scale of this type of a rollout, you know, to meet global demand.
Yeah. Mike, what's the next step here? Now that you've been able to do this, what do you do with it?
Well, that's a great question. So what we're now planning to do is we're planning to do a pivotal trial in a mouse model that is specific to tuberculosis, and that will allow us to prove the efficacy of selamectin against not only tuberculosis, but two of the strains. One would be a multi-drug resistant strain. The other one would be an extended drug resistant strain. And from there, we would then work with government and research institutes to bring this into a phase 1 trial in humans. We're already starting those discussions. So I believe that the pivotal trials will happen very quickly, and then we can give you another update, hopefully, of when we consider going into a phase trial.
All right, gentlemen, thank you so much. Great to see you both again. And as I say, every time we have you on, I learn more and more. So I appreciate that.
Great
Thanks,
seeing you,
Steve. Great to see you.
All right, there's Dennis Hancock, CEO, Mike Farber, Director of Life Sciences for Mountain Valley MD.